Hi, my name is Elizabeth Tatum and I'm a student occupational therapist, and today I'm going to be demonstrating a treatment that you can do at home with a TENS unit to control and relieve pain that you might have from lateral epicondylitis. So before you do administer this treatment at home, it's important to first of all make sure that you have good sensation on the skin in the area that we're going to be treating. So you just kind of want to feel the areas, make sure that you do have normal sensation, compare it to the other side. And then you want to make sure that you don't have any cardiac conditions, that you don't have a pacemaker, that you aren't pregnant, if you have epilepsy, malignancy, peripheral vascular disease, any decreased sensation, like I mentioned, mentation, any undiagnosed pain, or transcerebral pain. It's also very important to make sure when you're administering this that you don't place the pads over any CNS tissue or over the carotid sinus. So if you don't have any of these conditions, then this is an appropriate treatment for you. But if you do, then we'll have to look into some other options for you. So if we have determined that this is appropriate for you, now I'm going to show you where you're going to place the pads and how you're going to administer the treatment. So first, you're going to want to plug this little guy into channel 1 right here, and you want to make sure it's all the way in there so you have good connection. And then you're going to take your pads and you're going to plug your leads in. So you're going to just put them in there, make sure they're in nice and tight. And you never want to be pulling from the leads. When you can put them in, but when you take them out, make sure you're pulling from the plastic and pushing there. And when you're pulling the pads off, pull from the edges so that you're not pulling on this part because this is sensitive and it can rip out. So after you have them both placed, you're going to want to clean the skin, which is going to help the pads last for longer, and you're going to place the pads on the skin. So at home you can wash with soap and water, but in the clinic we use alcohol. It's completely up to you. So the first pad we're going to put over what we call the extensor tendon. So a way that you can find that is you can place your hand right here on this part of your arm, and you're going to want to bring your wrist up, good, and then the bulge that you feel, that's where you're going to want to place the first pad. So we're just going to go ahead and we're going to clean this area, and we're going to peel from the edge like I said before, and we're going to place the pad right there. And you want to make sure that it's on there nice and good so it gets a good conductivity. And then your second pad is going to go over the biceps. So you can just kind of flex your arm a little bit where you feel the muscle bulge. You're going to clean. And you're going to place your second pad. And you want to make sure that there's at least one pad width between the two pads. So if you need to actually use the pad to measure it, that's okay. You just want to make sure that they're far enough apart. Make sure that one's on there nice and good. And then you're going to be ready to set the parameters on your TENS unit. So first you can just go ahead, you can turn the unit on, and this is not going to start any of the conductivity. So you're just going to go ahead and press the power button here. And then what you're going to do is you first want to make sure that it says TENS N in the top left corner. And you want to make sure that you're working on channel 1. So first you're going to want to set your rate, and your rate is going to be set and to get to rate you press the set button until you see rate highlighted, and you're going to set the rate between 80 and 100. So we're going to go ahead and set this on 80, and then you're going to press set again, and it's going to bring you down to the width. And your width is going to be anywhere between 50 and 100. So I'm going to go ahead and we're going to just go ahead and set that at 60 so you can see that. And now you're going to want to set your time. So the time for your TENS can be anywhere from 30 to 45 minutes. It's really up to you and if your pain has been decreased. So there's a little time clock on the bottom. You're going to click it. And then I want to set it at 30, but if you want to up the time, then you just can press the up button or the down arrow. So after the time is set, you want to make sure that it's running on a symmetrical. So in the bottom right hand corner, you're going to see this little button, and you want to click it until it says sim in the middle here. So now all of your parameters are set. So what you're going to want to do is you can start it, you're just going to start increasing the intensity under channel 1. So you just want to make sure you know once you start to feel, you're going to feel like a tingling sensation, and that's normal, and you only want to increase it until it's tingling and comfortable. Once it becomes uncomfortable, then it's too high. So I'm going to go ahead and start increasing the intensity, and my patient here is going to go ahead and tell me when it's tingling but comfortable. Just tell me. You can feel it? Okay. It's good?
Mm-hmm.
All right. So then the machine is ready and it's going. So then you can just leave it there and it'll run for the amount of time that you've set it for. So now we're going to just say that the 30 minutes is up. So you're going to want to go back to the intensity under channel 1 and make sure you press it all the way down. And then just to make sure, before we take the pads off, you can go ahead and press the power button again and turn it off. So the unit is completely off, and then you can go ahead and remove the pads one at a time. And you're going to want to help preserve the pads, you probably want to place them back on the little sheet that they came on. Alright, and then after, you just want to make sure that you check the skin in the surrounding area. There could be some redness in the area, but her skin looks good. And you just want to make sure that you monitor it, and if you see anything abnormal, stop the treatment, and next time you come into the clinic, we'll look at it and make sure that everything's normal.